Hello everyone, welcome back to my YouTube channel. If you are a surgical trainee aiming for membership of 12 colleges of surgeons, then this video is definitely for you. Today I will be explaining about the MRCS Part A, and in the next video I will explain about the MRCS Part B. The MRCS exam is currently being conducted by the 4 colleges of England, Edinburgh, Ireland and Glasgow. So why surgical trainees opt for MRCS? It can help with the GMC registration, and most importantly, surgical trainees can get specialist training of their choice at ST3 level or above after clearing the MRCS. Eligibility criteria and the application process. Eligibility criteria includes MBBS or equivalent degree that is recognized by the General Medical Council. There is no need for any English exam for Part A, and there is no surgical experience required. You can take it in your internship or house job. Currently, MRCS Part A exam is held 3 times in a year, that is January, April, and September. How you can apply? First of all, you will have to go to the rcsengland.ac.uk website. You will check for the dates available, and then you can book your exam. The fees can vary, but it is around 550 to 600 pounds. Definitely, there will be some additional taxes that will depend upon your country from where you're going to apply. You will be asked to submit your attested medical degree certificate before getting the registration process for the MRCS Part A. And then you will get the admission letter 4 weeks before the exam. Now we will talk about the exam structure. MRCS Part A is a written MCQ exam that has 2 parts, Paper 1 and Paper 2. Both are conducted in the same day and it's a 5-hour long exam. In Paper A, you will be tested for your applied basic sciences. You will get 180 MCQs and you will have 3 hours to solve them. Then there will be a break of about 30 to 60 minutes. And then the Paper 2 will start. And Paper 2 includes principles of surgery in general. You will get 120 MCQs and you will have 2 hours to solve them. There is 1 mark for each correct answer. There is no negative marking. And the pass rate varies depending upon the diet. And it is usually around 65 to 75%. And again, it depends on the diet. So it is variable. You can get 6 attempts for Part A and 4 attempts for Part B. So let's break down the syllabus. So there are 10 key syllabus modules that are tested on the exam, which includes basic sciences, which includes anatomy, pathology, physiology, common surgical conditions, basic surgical skills, surgical patient management, perioperative care, trauma assessment. Trauma is one of the most important modules for MRCS Part A, along with the anatomy. Then pediatric surgery, management of dying patient, organ transplant, professionalism, and leadership are other modules. So now we will talk about the study plan and resources that you will be required. Preparation is everything. You have to be consistent. And the primary question banks which are currently available for the preparation of Part A is EMRCS. I will recommend using the online as it is updated version. Second resource that is available is the PASS test, but usually it is preferred only for Paper 2. Additional resources include Rationary Basic Science, Veterinary Surgical Anatomy, reader notes, Faucier sheets, and most importantly, the previous recalls. You should focus at least on 5 years of recalls. So preparatory time is minimum of 4 months and it can vary depending upon your job. If you're having a tough schedule, then I would recommend giving more than 4 months. And if you can manage around 3 to 4 hours of study daily, then 4 months would be enough. So the key to pass MRCS is daily MCQ practice. So you should aim to solve as many MCQs on daily basis as much as you can. So at the end, I will give you some tips and tricks for acing your MRCS Part A. Start early and stay consistent. Focus on the concepts. Try to make a visual memory associated with each MCQ and try to give some time on the explanations which are available for the EMRCS, for the past test, and various other resources. Practice MCQs daily, and now currently there are many study groups that are available. You can join any of them on Telegram, Facebook, or WhatsApp, whichever is available for you. And most importantly, read the last line of the question very carefully, especially on your exam day. In the last few weeks, try to revise as much recalls as you can and definitely do not stress one day before your exam. Remember, it's a tough path, but with dedication and strategy, you can make it. Keep pushing and never give up. You're definitely going to be the best future surgeon. At the top of the pyramid, once you have cleared your MRCS Part A and Part B, definitely you can get an specialist training, or you can also unlock many other opportunities in the United Kingdom, Middle East, Australia, Canada, and many more. So thank you very much and wish you best of luck for your MRCS Part 8. If you have any queries, you can contact me. I will leave my contact in the description. Thank you.